Can low iron be the cause of a lot of your symptoms? That's what we're going to talk about today, how to find out if you have low iron and what to do to clear it out. My name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and I've had the opportunity to see over 100,000 patient visits over the last 35 years, many of whom have thyroid and gut issues, and a common thing I see are deficiencies, namely iron deficiency. So what are the symptoms of that? Lack of concentration, fatigue, weakness, shortness of breath, heart palpitations, hair loss, decreased thyroid function, and oftentimes digestive symptoms are involved, IBS and other digestive issues. There's a whole lot of other symptoms as well. This is a partial list, and for kids in particular, decreased growth and development, ADHD, anxiety. So testing for it, you don't want to just check iron, okay? So you want to have your doctor look at iron, total iron binding capacity and percent saturation, and ferritin. Ferritin is a storage protein that can reflect your body stores of iron, okay? So iron level is just a brief view in your serum, and ferritin can reflect your body stores. So the ratio, the numbers are 10 to 150 for female, 20 to 400 for males. That's a huge range. So optimally though, I like to see 60 to 90, because if you are, say a woman, you're at 20, you can have major symptoms even though you're considered within the normal range. And then we're looking at other things you want to check as well. You don't want to just look at an iron picture. You want to look at the minimum, a CBC, comprehensive metabolic panel, thyroid, TSH, T3, T4, lipids. And I also like to check a number of other factors, but at the minimum, B12, folic acid, vitamin D, magnesium. So you want to get a more full picture. If you want a more complete list, and in my book I list a comprehensive health panel which has 27 different things. That's on page 104. You can take a look at that if you'd like, but at the minimum I would do these. What are the most common causes of low iron? Decreased intake, increased blood loss, so menstruating women, or if someone has other internal bleeding, like an ulcer, for instance. Decreased absorption. I often see gluten sensitivity and other food reactions with people who are iron deficient. Infections, so gut infections, parasites, yeast, bacteria, those can cause malabsorption. And leaky gut, another cause of malabsorption. So just to give you an example, so it's usually not just one thing, there's usually multiple things involved. Like I had a 37-year-old woman who came to me who was feeling a lot of these symptoms, so fatigue, weakness, shortness of breath. She couldn't even exercise. That's how exhausted she was. She also had digestive symptoms. She had nausea, vomiting, abdominal pain. She had been to many doctors. She had been to another functional medicine doctor before me, who actually did more testing, found out her ferritin level was low, and as well as vitamin D, so put her on that, but she still was feeling terrible. So came in, we did more comprehensive testing and found out that she had gluten sensitivity and other food reactions. She had infections, she had yeast, bacteria. H. pylori was one bacteria she had in the stomach, hence the heartburn and the nausea and abdominal pain. And she also had leaky gut, and she had other things as well. She had multiple deficiencies, not just iron. So what are the solutions for that? So just going out and taking iron, first of all, is not typically the best solution because, well, you have to make sure you're taking the right kind. So I prefer iron glycinate. It's highly absorbable and it is designed not to cause constipation or gut reactions. So iron glycinate, highly absorbable iron. You have to take the right amount. So I use a 29 milligram of iron glycinate, and for this particular patient, her ferritin was at 17. So I used 2 twice a day, and because one just isn't going to do it. So you have to do the right amount depending on what your levels are, and vitamin C is helpful to take with that. It helps increase absorption. If you're having low iron, most commonly you have other deficiencies as well. That's what I commonly see. It's not just iron. In her case, she was low, like I said, in vitamin D, plus many other nutrients we checked. And so I also typically recommend the functional 5, which is multivitamin, fish oil, vitamin D, magnesium, probiotics. Probiotics help with absorption, help with gut health. B12 and folic acid, those are common deficiencies I see as well that can help. And digestive enzymes, in her case, she needed a stomach enzyme that included HCl, so that helps absorb iron from foods, helps you break down your foods and absorb them better. And then on top of that, the free diet, because most people I see that are iron deficient are also gluten sensitive, hence the malabsorption. I put our patients on the free diet, which is not only free of gluten, but gluten, grain, sugar, yeast, dairy, eggs, soy, legumes. It's free of those foods most commonly responsible for inflammation, leaky gut, and other chronic health issues. So have her on that. And by the way, if you'd like a free copy of phase 1 food chart of the free diet, I'll put a link below that you can access that. So I put her on the free diet along with these supplements, and in 4 weeks her ferritin went from 17 to 89. So that was great, and most of her symptoms cleared up. She had more energy, her digestive issues had cleared up, the nausea was gone, and her brain fog lifted. She was able to start exercising again. So it's amazing what can happen when you find out the underlying root causes and are provided the right solutions. It's also important to follow up. So you test, you find out you're low, you take the iron for a while to do a protocol, and you want to get retested. And then when your levels are good, it doesn't necessarily mean you could stop taking iron. You can adjust the dosage accordingly. You may be able to stop taking it. It really depends on a lot of factors. So you want to follow up to make sure that you are consistently and on the right track. So thanks for joining me today. And if you like this video, click the like button below. Feel free to subscribe to my channel. And I'll put the link below for a copy of phase 1 of the free diet. And we will see you next time. Take care.